Hi, everyone. I'm also going to be brief. As with Rod, I'm just plugging a service that's going to be forthcoming very soon. But I want to say thank you to Olivier for organizing us all to be here together, and thank you especially to Jeff and Rod and Leslie for that fantastic presentation. That was really a lot of new information for me, so thank you. So the project I'm going to plug is called MindMap, and this came about because of local research data from a survey that I led in collaboration with the BC CDC and HIM back in 2016, and a subsequent survey of sexual and gender minority Canadians, gender diverse, led by Olivier and a team of us called the Still Here survey that happened in 2017. And both of these studies, I'm showing specific barriers that queer and trans people reported when they tried to access mental health and substance use care. I'm not going to spend a lot of time here. I think you've already gotten the message this morning. And I'm not putting them side by side because I want you to compare the two surveys. They're very different samples. But I've highlighted three particular barriers that stood out as really prevalent in the two surveys. One was a lot of queer and trans people are unable to afford mental health or substance use services. In some cases, they're not able to find it. And in Still Here, we saw that about a third of the people, and these are people who are scoring quite high for depression or suicidality, can't find someone who's queer or trans affirming. And as you're probably convinced from the data, the qualitative data that were shared earlier today, this is really an important piece that keeps people from accessing mental health care. So following up on this survey, I sat down last year, Stephanie Black, a student from UBC, and I sat down and we talked with nurses and physicians who are working in those STI clinics in British Columbia to understand, well, what do they do given these barriers? And I want to acknowledge my colleagues and friends Lindsay and Julia who are over there. Hi. Because what Lindsay and Julia and their colleagues have taught me, they're sexual health nurses, is that clinicians work very hard to find what works for their clients. And so we, as queer and trans researchers and practitioners, can help them. We can do more to support them in connecting the dots. So what I heard from a lot of the clinicians I interviewed was that, you know, I see really high levels of need, but when I go to make a referral, I just feel really cynical that because of some of the barriers that Olivier mentioned earlier, that it's not, the referral's not going to go through. Or maybe they're going to go through the intake process and then wait for weeks or months to get into the service. So a lot of pessimism and then coaching their clients to be really guarded in their expectations when they access services. And then one sexual health physician, but actually like 10 different people said this to us. You know, I feel like what would be really useful is if we could just have one place where we integrate all of the low barrier services, in particular for queer trans clients. And so we're like, well, that shouldn't be so hard to do. Let's do that. So we did it. This is like the longest running and most severely underfunded project you'll ever hear about. And so I'm hugely grateful to the people who are listed here and others who aren't listed here, because a lot of these people, so much volunteer and paid labor went into this. And in particular, I want to acknowledge Erin, who's here. Hi, Erin. And I don't think Darren is in the room. Darren and Sergak, who is still at the registration desk, and Quincy, who's not here from Positive Living, because they've done a ton of work to help get this together. And then we've relied on a group we have here in Vancouver called the Roundtable, which is BC's LGBTQ2 mental health and substance use networking space. And I see a lot of Roundtable members in the room here, and you're all invited to join us. So just email me if you want to join. We're a very open group. We meet once a quarter, and it's led by queer and trans people working in research, community, or practice. And it's a very simple, low barrier setup. You just come to share information about projects you're working on, and if other people want to join you, they do. And we believe that if we keep getting together every quarter, eventually we're going to shift resources for queer and trans people. And we're doing it, and MindMap is a great example. So here is how we did it. We took I'm just showing you 4 of the databases we took. There's actually about 8 in total. BC211, which is, for those of you from out of the province, this is the government-funded service that's meant to be providing access to services when people need it. Doesn't have great specificity, in particular for queer trans people. Good luck figuring out which services on BC211 are queer trans affirming. Here to Help, which is a fantastic mental health resource led out of the Canadian Mental Health Association. HealthLink BC, again, a government-funded service that's meant to get you to the proper health services you need. And Health Initiative for Men has a fantastic mental health campaign called Take Time for Your Mind. And we used the list of providers that had already been vetted through him. And we put them all together and we said, okay, you can get into the MindMap database if you have one of these 3 things. You're low cost, that means you're either free or you're sliding scale. You can refer yourself in, so we're interested in reducing some of those steps around the referral pathway. And in some cases, if you charge more money than we might like, we'll include you if you have an explicit focus on two-spirit or queer or trans-affirming care. And we determine that through the roundtable. So Aaron and Darren and several others, when we have a service in there and the provider says we're doing queer and trans-affirming work, we check with our partners to make sure that's true. And we excluded individual counselors because there's existing databases that list individual counselors. We excluded for now services outside the Lower Mainland, although our goal is to make this provincial in scope. And then some people just didn't have time to get back to us when we verified the service. So this is it. Don't write down the website, but please don't share it or use it because the database isn't complete. It will be in a couple of months or sooner. And there's some functionality pieces we're still working on, but I'm kind of creating buzz about it. And right now we have 95 services in the Lower Mainland. I think when going back to those interviews last year, a lot of the providers I talked to would not have believed that we have 95 low barrier mental health or substance use services. And you can see here, 36 of them have been identified as queer trans affirming. For the most part, these services are individual counseling groups or referrals resources, but we have also tagged where we have crisis counseling, addictions or recovery services or online services. And this number will increase over time and will change because as people know, services are opening and closing all the time. So our next step is we're doing a pilot test this winter. The pilot test is focused on those same sexual health clinicians who suggested that we build the service. So they are going to get kind of the first pass at it, as well as anyone who's a part of the roundtable. So some local community organizations like HIM and Community will be helping us with the pilot testing. And then once we've kind of worked out the kinks, we'll do a community launch next spring, so stay tuned. We're working with some Indigenous and Two-Spirit colleagues to separately vet a list of services that are take care around Indigenous cultural competency and services that would be Two-Spirit affirming, and then eventually we'll go beyond the Lower Mainland. So send me an email if you have feedback or want to be a part of our pilot or you want to come to our roundtable. And I should mention, although we were severely underfunded, we have recently gotten a small bit of money from the Blue Cross Foundation, and also I'm super grateful to Positive Living, HIM, and CBRC for their in-kind contributions. Thanks.